Rose Johnson, and Clinic Manager, Family Medicine, Women's Health, Tracy Van Buskirk. Welcome. Welcome back.
Morning.
Thank you.
Thank you. Thank you for having us.
So you guys were snow day yesterday, but you were open all day, and were you busy?
Yeah, I think we were pretty busy.
Yes. Yes, we wanted to make sure we were able to see people who needed to be seen in spite of the snow. So yes, we stayed open, did not close.
Are we seeing any signs of the RSV and some of flu A and B going down or going away? I feel like a lot of people that at least maybe were in my circle had a really bad October and November, but seem to be doing okay now. What are you guys seeing?
I think I would say that it is a little better, or at least it's kind of staying steady. We're not seeing a huge increase in RSV, flu, or COVID also. Some of it could be people not coming in for the testing, but I think it is kind of stabilizing right now. Yeah.
What's going on? What's going around right now?
I would say we still have it. We still have COVID, we still have flu, and we still have RSV. It's just that it's not as bad as it was at the end of last year.
I know there's a 24-hour bug going around.
I had it.
Some kids have had it, some parents have had it, but it's 24 hours.
It's 32 hours.
Well.
Now the flu season is typically all winter, and is it too late to get the flu vaccine now?
No. We actually, I was really excited to come back on today and talk about COVID and flu again because I think that we kind of feel like it's going away a little bit when it's not. And so I wanted just to reiterate to our community that it is still there. It is still important to come in and get your flu vaccine. 6 months and up, we have high dose flu for those folks that are over 50. And we also have all of the COVID vaccines, the Novavax, the Moderna, the Pfizer, and for the primary series and the bivalent for the boosters. So even if you had the primary series, it's important to come in for your health and your family's health and get the booster.
Tracy, what can we walk in for? What are some of the walk-in services? Would the vaccines be one of them?
Yeah, we definitely do walk in for the vaccines, all the vaccines, and you don't have to be a patient at the center to do that. So we have all the regular childhood immunizations, and our walk-in is on the second floor, and Monday through Friday, 9 to 5. Nice. So for 6 months and on.
And those downtown, Northwest, Parkside. Is the Lifeways Center for Family Health back up and running?
We are there on Tuesdays and Wednesdays, but we don't have walk-ins for vaccines there.
How has it gone with a few of the school health centers back open and able to see children?
Yes, really good. Really good with our schools. Both Parkside and Northwest, like we said, are both open, and we've been seeing patients. Both kids and adults are welcome to be seen there. So it's helped the community. It's kind of like a private office where you can just walk in, get the services, and we can get the vaccines, both flu and COVID, and other vaccines too, at our school health centers.
And even if you can't make it during the day, you'll be able to schedule some evening appointments too, right?
Yes. Yep. Yes. We have evening appointments at the main 505 in our main office, but we also have our walk-in open all the way till 9. So anybody can be seen, again, not just for our patients, but anybody in the community is welcome to come and be seen in our walk-in.
Early in the flu season, the high-dose vaccine wasn't readily available for seniors. Now that you have it and it's available, if someone got the regular dose flu vaccine, say in October, is there any benefit to getting the higher dose flu vaccine now?
Well, it actually is not recommended to get a second dose, whether it's high dose or the regular. I know there's this thought about the waning effect of the flu vaccine, and there might be some effect or some waning. However, it's not recommended to get a second dose of during the same flu season.
I think the symptoms for RSV and COVID and flu, they all share some common symptoms, right?
Yeah. That is correct. Yes. It is sometimes hard to differentiate which one it is, and so we, of course, we can do the testing in our walk-in and in our in all of our offices. We can test for flu, COVID, as well as RSV.
And depending on what you have, there's either nothing you can do to treat someone, or there are some things.
Correct. So of course we have for flu as well as for COVID, we have medications that can be given. For RSV, although there is maybe not any specific medication, we need to monitor them very closely. So we can always advise about remedies that can help with symptoms. And of course with the breathing, we have medications to help with the breathing. Yeah.
Yeah, and I think all three of those have the potential to impact your breathing.
Absolutely.
Which could even lead to hospitalization.
Absolutely. Very important that we take them seriously.
Do you have walk-ins that will come see you with a struggle of breathing, and then you recommend, either a hospital visit or something else?
Yes. In our walk-in, we have some simple URIs
Sure.
and other conditions, but yes, we've also had cases when patients come in who have to be sent to the ER. But I think when someone has a question about what to do, it's just very easy to come to our walk-in and be seen so they can know the next steps.
Right.
So obviously these conditions, RSV, COVID constantly developing, we're learning about everything really in real time. Are there some things that you offer patients in terms of resources, just overall health, prevention, that someone can take advantage of when they're feeling okay?
Yeah, so definitely that's why we also encourage preventive visits. So we want people to come in for like physicals. We talk about how we can care just overall for various screening, but also to be careful and what to do to try not to contact one of the illnesses. Resources wise also, we offer a lot of help with other like insurance concerns, transportation questions. We have a food bank that we help our patients with. So there's a lot of resources. I think what I'd like to let the community know is if there's any question, please call or come in and we'll be able to assist with the questions and concerns.
And if you get a call from someone that hasn't had a physical in 10, 15, 20 years, they won't be the only person that you've seen.
Yes.
But it is very important to get a
That is
physical
correct.
every single year, correct?
It is really important to be seen and managed and have blood work if necessary. Not
Yeah.
everybody needs it, but
Okay.
yes, that's an assessment that can
Yeah.
be made.
Yeah. The longer that goes out, the more apprehensive people are to make the
That is
appointment. aren't
correct.
they?
That is correct. And I agree with you. We won't be the only person who
Yeah.
hasn't had a physical in 10 years. So please don't hesitate to come in.
And I think during the pandemic, there were a lot of people that just put off their appointments,
Yeah.
particularly dental care.
Oh, right.
They're just, and I think there was just a fear that you could get COVID by going to the doctor, and that kept people, I think,
Yes.
away for
Yeah.
quite a while, didn't it?
Yeah.
Yeah,
It did.
that is correct. We are definitely seeing people coming back. That is awesome. That's wonderful. People are beginning to come in. No, I shouldn't say beginning. They've been coming in to get care, and we continue to encourage that, of course. Yeah.
When we say healthcare for all, that, you really mean it. That's your tagline, opening the door to healthcare for all for more than 30 years, and that's been really, I think, a big push during this last year of you are allowed, able, invited to come in,
Please
and
go
it
in,
doesn't
yeah.
matter who you are.
Yes. Very correct. Yes, we do want to help anybody who needs any help, any questions. We are there, and that's why we also have very accessible and wide hours so that we can help our patients and the community.
Yeah, and if, like you said, people have questions on any of those issues like insurance,
Yes, insurance questions.
transportation, you actually located your health centers in neighborhoods, and people actually walk to
Walk,
their
bus,
appointments.
yeah,
Absolutely.
of course.
And bus, yep, they're in town. A lot of folks at bus, and we help them with that too, being able to afford a bus ride to
Yeah.
get to us.
That's awesome.
We appreciate all you guys do at the Center for Family Health.
Well, thank you.
Thank you.
Thank you very much.
Dr. Rose Johnson, the Chief Medical Officer at Center for Family Health, and Clinic Manager, Family Medicine, Women's Health, and Lifeways, Tracy Van Buskirk. More of the morning show coming up.